And we wanted to provide you with another update. As always, I'm joined off camera, of course, by Dr. Rex Archer, our Director of Public Health, and Dr. Erica Carney, our Director of Emergency Medical Services. We're here both to give you an update, but also to note a few things that have changed since we last had the chance to visit. As we have known for some time that we've had community spread in our area, we now have diagnosed cases out of Kansas City, Missouri. This was something where in some ways we were a bit surprised by the amount of time it took for it to officially arrive, but we certainly recognize that we are at a point now where I think folks need to even double down further in connection with following those good hygiene practices, making sure you're maintaining social distancing, and making sure you're adhering to all the orders that have been issued both by the mayor's office and by the Director of Public Health. You've heard some of the bigger things that we've discussed, closing bars and restaurants from dine-in opportunities, schools being closed through a period at least through April the 3rd, and certainly observing to the 10-person within a building limit, or 10 persons, within an event limit, and maintaining social distancing as often as possible. We think these are vital. We have taken important steps to try to make sure that we will not have an increased spread. And these steps are important for public safety. They're important for everyone's health. Even if you're someone who feels as if you will never get sick, first, you're wrong, but second, you can be one who is actually transmitting to others. So we continue to ask Kansas Cityans to be vigilant, not just for their own health, but for everyone else's. One other point I want to make is this: we continue to work with the state and with our federal government. I have appreciated over recent days, I think, an enhanced level of interest and aggression in fighting this virus from the federal government, from the Centers for Disease Control, the White House, and others. I think that helps those of us here at the local level. We continue to seek further resources to help address these issues because we understand that one city can't fight the problem. Indeed, we need our entire region and our entire country. With that, I'll allow the professionals to visit with you. I'll remind you that we continue to take their advice in connection with all orders we issue, all important steps we take. One other point I will make is the Kansas City, Missouri government continues, of course, and folks can still expect us to do those services that you expect. However, we will note that we have more staff that are working from home, as has been recommended from the government side as well. And indeed, even the City Council has been conducting meetings by both teleconference and tomorrow's meeting by video conference. We hope that that modeling makes clear to every business in Kansas City that you should be looking to do the same. With that, I'll introduce Dr. Archer.
Thank you, Mayor. So anybody that's listening has known that this is coming and would be here. And we've assumed that we've had cases, and that's why we've started all these different practices. Changing habits aren't easy, and we're asking all of you to help us in doing that. But as a doctor, I want to really emphasize that the people that are having the most serious problems from this virus are the folks that already have heart, lung problems with their immune system. If they're over 60, like I am, or if they're over 70, it's even higher risk. So we all collectively have to help protect them and avoid and stay back from them so that we're not passing this disease to them, because some people can have this disease and not have a whole lot of symptoms. In fact, the 2 cases that we're reporting on today are at home doing well without hospitalization or care at this point. So that's kind of where we are. But I'm also asking folks that aren't in those high-risk categories to not be exposing other people. If you have cough and you're sick, you shouldn't be doing that. So with that, I'll have Dr. Carney talk a little bit about some of the concerns we have in the burden of the healthcare system. I do want to remind folks that we now have several hundred tests going in across the metro area from hospitals every day now to different labs. And these 2 results that we have now, we know that we'll have more coming. We are not testing here at the health department, so people shouldn't show up here to be tested. They can get testing through other mechanisms, but they need to call first before they go into their healthcare provider. Dr. Carney will focus on that a little more.
Thank you, Mayor. Thank you, Dr. Archer. I echo what they say. Here in Kansas City, I want to publicly commend the mayor and Dr. Archer and their team for the amount of hours they've put in preparing for today and the announcement of these 2 positive patients. My message remains the same. If you are only experiencing very mild symptoms, if you do not have severe symptoms, and if you are otherwise young and healthy, we recommend that in lieu of calling 911 at this time, in place of that, you would call a primary care physician instead. Calling the primary care physician allows the ERs to stay less busy. That way, once the virus spreads, we can keep beds available for those who are at higher risk. Patients who are at higher risk, as we have found, are those over 60, especially over 70, and if they have comorbid conditions like a heart issue or lung issue. Pregnancy, cancer can also be considered to be at risk at this time. Questions?
Questions?
Yeah.
All right. So, any questions? And to make it easier, because we are keeping our social distancing as well, I guess for those who have questions for me, just run through them, then we'll go with the doctors respectively. All right, so any questions I can answer for you? Yes, sir?
What do you attribute Kansas City, Missouri as one of the last areas officially with? Is that because of testing? Is that because of good hygiene? What do you think it will cost that?
Oh, gosh. I don't think it is anything more than our fortune in some ways. I think when you look at the community transmission that we have seen, it is very likely, indeed, it's almost certain that some, for example, of the folks that had been detected in Johnson County, Kansas, flew back with it, which meant they actually were in Kansas City, Missouri, ever so briefly, and so I think we've had community transmission for a matter of days, if not longer, or weeks, and so I think we are just seeing detection now. Certainly, as we have more testing, I think we will probably see a heightened number of confirmed cases. I think that will reflect, frankly, every part of our metropolitan area and, frankly, regions throughout the state of Missouri and the state of Kansas. I mean, we've had detections in Henry County, which is certainly not an urban area. We've had them in suburban areas of our state. Now in urban areas or more urban areas, I think you'll continue to see that. That's why I think our biggest message today is continue to follow the methods that we have laid out. Continue your social distancing. Continue, frankly, remaining home in all but essential situations, because we are not out of the woods. You know, there are a lot of people, and I feel for them, both from business, parents, teachers, so many, who have asked me, when is this all over? The answer is a very unfortunate, we do not know. What we know right now is that part of the way that we're addressing this illness, not just in our country, but around the world, is through our containment strategy, is through the efforts that we've announced here, and we're going to continue to be as aggressive as possible for as long as possible to try to make sure that we are not in a more dire circumstance. One other thing I might note, we have had a number of calls with lots of medical professionals, and I have 2 outstanding physicians here with me who have been the genesis of that. And in a call that was organized yesterday or the day before, we visited with hospital leadership from throughout the region. And a lot of them were talking about how important it is for our EMS teams, for their staff, to have access to supplies. Access to supplies isn't just about money from government, it's also about all of us, regular folks, not actually influencing the supply chain. So what I mean for that is, if you're one of those doomsday scenario folks who's buying every glove and every mask possible, and you're getting on Amazon and you're saying, I've got the N95 or anything of that sort, please stop, right? Just, you don't need it, right? You don't need it for your doomsday scenario in the basement at your house right now, okay? Our medical professionals actually do need it. Our paramedics, so many others, actually do need good supplies for when they're responding to situations. And frankly, you know, while we've had good supply chain opportunities in our country, particularly grocery stores, et cetera, we do want to make sure that we actually continue to have a good supply chain in protecting our healthcare workers as well. And that's vital for us. Yes, ma'am.
Are either of these cases from the Hallmark or Cerner cases that we heard
And
about?
I don't actually think we're sharing that particular information at this time, but I'd encourage you to keep investigating. Yes.
Any changes in your public transit within the city?
We'll have more conversations about public transit, actually working with the health director, our KCATA director, our streetcar director, and others. I think what you are likely to see over time is us continuing to recommend only essential travel, but we understand there are a lot of people that ride public transit for whom that travel is essential. We have added in more spacing, mandated spacing on the bus system. They continue to have heightened cleansing on the bus system as well. And I think there are a few things that we want to make sure that if we have to close them down, they're near the last things. And that included in that is public transit. It's not a light thing for us to say we're going to strand people in parts of the community, people who need to actually get to the doctor, get medication, get food, etc. And so the bus system remains open, our streetcar system remains open. I think you'll see announcements in the next several days about perhaps service reductions, but we're going to make sure that we're able to keep those clean, keep those moving as long as possible. Yes?
Do you think that Missouri needs to do what Kansas just did and shut down school buildings?
First of all, I take my recommendations from our medical director, our advisors. I've not heard that recommendation yet. I think we continue to look at this every day, every week as we update. Currently, we have a closure of our public schools in Kansas City, Missouri, and then by default, most of this metro area on the Missouri side for a period that runs through April the 3rd. We will evaluate as necessary if and how long that needs to be extended. But I have not heard from our medical professionals that we need to close the schools for the remainder of the school year. As you've heard many times, there are lots of factors that you have to think of when doing that. And we're at the point now where we don't think we need to make that declaration.
One more for the mayor.
All right. Thank you all, and thank you for taking information.
So before moving into question, I want to follow up on the other one that you talked about. So every year when we have various outbreaks, and we've had at least one outbreak every of the past 20 years that I've been here as a director, the first case sometimes is in Kansas City, Missouri, sometimes it's over in Johnson County, sometimes it's Platte County. It varies. But the thing is, with diseases that spread from person to person, they often move past those jurisdictional lines. So wherever the first cases occurred, you would expect to have more concentration there, but as networks spread out, you get it other places. So that's kind of the answer to that. One thing I do want to focus on is you'll notice over here on the wall it says maximum occupancy of 125. Now that's based on fire code safety. But we actually think that's a pretty good measure. There's actually some technical ways that the International Fire Code does those analysis. And if you divide that by 4, we're saying that you shouldn't be crowding rooms with this going on right now above that number divided by 4. So I didn't have to ask any of you to leave today because I did the math. I looked around, saw how many were here, and we're under that criteria. And that's one that we're moving out and getting businesses and other groups to be looking at as a way to keep better social distancing. I know this is a little bit different because a lot of times your reporter's with you, standing next to you as a photog, but we're separating people out on purpose. So I just wanted to go ahead with the questions now.
Do either one of the workers work at IRS?
We don't release that information. We contact where they may have exposures. So we will work within those systems if they may have been positive at a time that others from that workplace or wherever would have been exposed, then we do that background work with our 6 folks that do that kind of work.
Also, were they tested because they were really sick and went to the hospital, or were they around someone else who tested positive?
They were ill and were tested because they were ill.
Can you talk about the rate of the spread? I've been reading online that it should potentially double every 3 days. Is that your prediction?
We're seeing different models right now. It's still early in the curve in this country, but it can go as early as every 3 to 4 days. So yes, at that rate, you can see that it multiplies pretty rapidly. So we think it's going to continue to hit, and the practices and the changes that we've been putting into place now really matter because this is going to grow.
Dr. Archer, do we know if these 2 individuals traveled out of state, or was it a transmission within our community?
I am aware, and we're still doing some of the epi work on these, but I'm aware of one of them that did travel out of state.
Those 6 disease investigators that you have assigned, just talk to us about what the protocol is in doing that travel history, get into the nuances of what that is.
So I don't do this work myself as much anymore, but I can tell you that it's a very complicated process by which these people are very skilled at helping people remember what they've done and where they've been. And often the first time you ask the questions, it's not till even later that day or the next day when you follow up again that people's memories start getting stronger when you start looking back over a period of time that they may have been exposed. So it's a very skilled position. I'm really proud of our folks that do that, and they have to kind of help people remember where they've been and who they might have been with.
And once that happens, does the investigators reach out to those businesses and let them know?
We reach out wherever that is considered high enough risk from that exposure, yes. So as an example, when we had a TB outbreak in a high rise, we knew that there was a case. We went in and actually in this case, we had an easy test that we could just test everybody a couple floors above and below. If we got too many positives and we realized, well, we're not wide enough, so we're now gonna have to go more floors. So that adjusts each time that we do this. The same thing will be happening with this. And as the availability of screening becomes more online, we'll also be able to potentially screen people that are lower in symptoms than what we've been screening right now.
And Dr. Archer, if Kansas City sees hundreds of cases at some point, will it just be overburden on those investigators, and will individuals have to just essentially self-report to those institutions?
The number that they're following right now, if they weren't so dedicated and they're spending a lot of overtime, and some of them don't get paid overtime, but they're just putting in 60, 70 hours a week. We had one employee who had to drive a sample up to the state lab because we really needed to know the next day whether that was positive, because it might impact 400 other people that were exposed to that person. Fortunately, that was negative, but that's the kind of work they do. Under the emergency funding that's coming down from the federal government through the state to us, we are adding 7 additional disease detectives that can do this type of work. But you're absolutely right. There will be a point in time where the level of disease will overburden our ability to do that type of work. So it'll be interesting to see at what point, and that's part of the reason we put all these other processes in place. One thing that I haven't seen happen in this country that I'll just put a plug out for, I was listening to a radio station, I think it was NPR, and they talked about Spain, and now Spain, I think at 8 o'clock every evening, everybody kind of goes out and claps and applauds all the healthcare and public health workers that are working on the outbreak. And I could just tell you that our healthcare workers and our public health workers need those acknowledgments for what they're doing in this outbreak right now.
Okay.
Just one more question. There are some folks out there that might not have a primary care doctor. What do you recommend that they do if they're feeling ill or have something?
Yeah. So what we always recommend, if you do not have a primary care physician, most primary care physicians have a nurse call line, and a lot of places have ramped up telehealth at this time. So even if they can't physically get you into their offices, you can at least discuss your case with a nurse practitioner, physician's assistant, and or a physician at this time. So we always recommend you at least give them a call.
We also have 3 federally qualified health centers. We have 3 federally qualified health centers, Sam Rogers, Swope, and KC Care, that people can contact to get into care.
Can you talk a little bit more about why these cases you believe are unrelated, are they on opposite ends of the metro? Kansas City is a huge city covering multiple counties.
No. Do you want to give that one back?
We believe that these cases are the tip of the iceberg. So there will be a lot more cases. There will be cases that are related to other cases, but these cases we feel we've not been able to find a common source or any overlapping exposure. And for any of you who have watched, the police and various crime scene things where they're looking for connections between 2 folks, that's what our folks do, is to try to find those connections and overlap, and we haven't found that at this point.
Do you think you'll need to reduce the sizes from, I think it was 10 people down to 5, like some of these other cities have done?
we will watch, and we don't overreact or underreact according to what we're seeing. So yes, it could go down, it could go up. We also would anticipate that at some point it will wax some, but many of these measures may have to be brought back in again. We're going to be at least 18 months, I think, before we've got an effective vaccine that we can mass produce and get to people to stop this outbreak. So it could be that we'll have to do these measures additional times over the next year and a half to quell the outbreak. It'll go down a little bit and then it'll come back up.
One more question.
Just a clarification really quick. The test kits availability, you mentioned there are several hundreds that are going?
So we can submit as many tests to the state lab that meet the criteria of the state. The test kits is not a limitation anymore. So I just want to make that clear. The private labs have also increased their capacity. So that's why I'm saying there's a couple hundred tests going in daily now from the metro area between those two sources. So that's becoming more available. But I will mention to folks, the issue of the test helps us in figuring out who might have been exposed, but it doesn't change the treatment for the individual. So if the doctor sees a person and doesn't feel that the test is needed, they're still treating the patient the best way. It's not going to vary on this diagnosis.
Okay, thank you. I know you have shoes to get.